Hi guys, welcome back to RT Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the Asthma Lady. Yes, welcome everybody. Welcome to anybody new. I just want to give a shout out to Leah Clark and the Delaware Society for Respiratory Care. I spoke for them this past couple of days, and so I was super excited to be there with them. They welcomed me with warm arms, and they're doing great things, spreading the RT profession pride. All right, so guys, I was also able to go to, after that, I've had a very busy week, if not month. I was also able to go to the Black Health Matters Summit and Expo in Newark and New Jersey. So there they were speaking on different healthcare concerns and chronic diseases such as prostate cancer, breast cancer. They were talking about multiple myeloma and just different stuff around that. And they were also, trying to talk about clinical trials and the difficulties of recruiting minorities into clinical trials. And just having the difficult conversation around that. So today's episode, we are speaking on having difficult conversations and speaking on difficult topics. All right, guys. So yes, that is the vibe for today's episode. Don't forget, on June 10th, we are having a vision board party. So come through, have a good time, come speak your dreams, come leave with a vision board, food, raffles, giveaways. So it's going to be a great day of just being together. So the description for that will be in we'll have a link in the description. And also, don't forget, if you guys need the book, folks are still asking me questions around this type of stuff. The book, Asthma Control, Please, 9 Steps to Community Engagement and Asthma Awareness, is also available on Amazon, Kindle Unlimited. So that's also available. We'll have the description for that as well. Okay, so lately I have been speaking on just different topics, and especially for Asthma Awareness Month, which is still happening now, just speaking on health disparities and specifically asthma disparities. This is not an easy thing to talk about because we have to unpack and have the conversation around why certain zip codes are seen as sicker than others, right? So it's crazy to say that your zip code can predict your health. So we do home environmental assessments for asthma, and so it's hard to talk about things like environmental triggers such as pests. So it's talking about cockroaches, mice, and rats, and how this may not be isolated to the specific patient. So someone can be very tidy and clean and still have a pest infestation in the home because it might be linked to the actual building. So what we are seeing is in different zip codes is conditions of the building and the area where it's not isolated to the single person. So I speak on public housing a lot and what I've seen in public housing. Now, full disclosure, I personally has never lived in public housing before, but I've done home environmental assessment in quite a few. And just to say that these buildings, it's well known. These are not my facts. These buildings are deteriorating. So they are well over 80 years old, 90 years old. and they're not being well upkept. And if you're not aware of what attracts cockroaches and rats and roaches, like foundations, cabinets breaking down, leaky pipes, and these things attract pests. And so it may be so having conversations around the stigmatism of even talking about dealing with pests and dealing with pests in the home. It's a hard conversation to have because a lot of people don't want to talk about these topics. You know what I'm saying? They don't want to talk about these things, but they do relate to a lot of patients that go to the emergency room, especially in minority communities and in urban environments and multifamily housing. It is just unfortunate that it may not be you, the actual patient, causing the problem. It may just be the condition of the building. So, these things are, so we're talking about systems that are where people are set up for failure. You understand what I'm saying? So, these buildings, they need to be funded. This is connected to politics, which is like, outside of my scope or whatever, but I have started to do more work in the, patient advocacy space and speaking on patient behalves. And just because of how annoyed I have been with just seeing what's going on in some of the conditions of these buildings. And think about it. I was very surprised to not see, asthma education and awareness at the Black Health Matters event in Newark, especially asthma being such a big healthcare issue in Newark, New Jersey. And once again, is largely linked to broken down buildings like the school buildings and public housing. And these buildings just not being upkept, landlords painting over mold, and once again, just patients, people going to the emergency room and using that as their main source of getting healthcare services and not doing preventative healthcare, not having a PCP and these type of things. And so we need to talk about the difficult situations. The difficult topics. And like I said, when I'm doing these type of presentations, like the one that I give often, which is Asthma Education with Passion, I do speak on a lot about asthma disparities and, what we can do to bring awareness to these things and just let folks know that this is happening in communities, minority communities across the country. They're not like isolated to one specific area. So while I can only really speak on visually what I see in the New York and tri-state area, it is well documented. And for years that these, especially in relations to environmental triggers such as pests, being a big issue, and it's not really being discussed why it's such a big issue. And so when I have to talk about these topics, I just try to make sure that I focus on the intention. And while the presentation may not always be well received by everybody, I know that my intentions are good, and I hope that that's what people, most of the people are getting. There's just like the awareness and how to help spread the education and help others bring attention to these type of things and speak on it and have healthy conversations on it, and how we can come up with real solutions versus band-aids where, programs are getting funded now and again and just chipping just chipping the tip of the iceberg. And because once funding come in and out, the resources are no longer available to certain patients, and the barriers are still present. And so I'm going to continue, me personally, I'm going to continue to have the difficult conversations around those things. As the asthma lady, I speak on anything asthma related, but I'm not scared to talk about cockroaches and rats and mice and what we see. And I know folks might try me and try to call me the roach lady, but don't do it. Don't go there. Okay. So, but all jokes aside, I'm not scared to talk about it. So people just need to know how to ask for help if they truly see an infestation as far as pests in their home. Know that these things are potential asthma triggers. They are the body parts and what pests leave behind, or what the asthma triggers. So some folks will try to solve the problem on their own because they don't want to talk about it. They don't want to talk about it with anybody else because of the stigmatism of dealing with these things. But what they'll do is they will use these chemicals, which are asthma triggers as well, and kill, the cockroaches or whatever, but not realizing it's what's left behind. So they're not aware that they should vacuum what's left behind with a vacuum with the help of filter, because the particles, we don't want, when you vacuum, the particles to go once again be dispersed in the air, which are potential asthma triggers and may continue the cycle of the person going to the home. And so we just have to start to use resources, quality resources from trusted sources on speaking and being able to speak on these type of topics. I've had back when I was the chairperson to the North Brooklyn Asthma Action Alliance, I used to show pre and post pictures of some of our home environmental assessment. I would spare people some of our very graphic pictures, especially if they did not have lunch. But I just always would like to show kind of like the receipts of how to really help people deal with those issues, and just peeling back the why these things are hard to talk about. All right, guys. So as time go on, I'm going to be speaking more on those type of things and creating content around those things, and just seeing where that goes, and just working with different organizations and stuff like that. And continuing to bring awareness to these type of issues, and speaking about the difficult things, and things like clinical trials, and why there is a distrust in minority communities in regards to these things, and and how we can move to a better place, move the needle towards positivity, and being able to enroll minorities into clinical trials, and getting the research out there, and getting the medications and everything that we need to get people to a better place. So, but anyway, guys, that is it for today. I hope you learned something from me here today. Please remember that we are on the Patreon space. Got content coming up for that too. Been busy, but I will get to those things. Once again, don't forget our vision board party on June 10th, coming up very soon. The month is going very fast, so everything will be linked in this to this video and content and podcast episode. And yeah, guys, so much more to come. We have more guest co-hosts coming, and just more exciting topics to speak on. All right, guys. So yes, hang in there with me, and remember, we are growing together. All right, guys. So yes, so everyone, just please remember to invest in yourself and to only compete with yesterday's version of you. I'll see you next week. Bye.